Welcome to Science Easy Tech channel. In this video, we are going to discuss about 2 marks answer key for the subject Medical Surgical Nursing 1. So this was taken from Dr. NTR University of Health Sciences. Now it is called as Dr. YSR University of Health Sciences. So this answer key Medical Surgical Nursing 1 is for Bsc Nursing second year. Before moving on to the topic, if you are new to Science Easy Tech channel, just take a moment to subscribe our channel and also to press the notification bell icon in order to get connected with our latest updates. So the content what we are going to discuss is, as I have told earlier, it is 2 marks Medical Surgical Nursing 1 question paper, November 2018, Dr. NTR University of Health Sciences. So now the university name has been changed to Dr. YSR University of Health Sciences. So the first 2 mark question is, complications of tracheostomy. They have asked only 2 complications of tracheostomy, but I am telling all complications, and this is not an explanation video. This is only answer key video for what question, what answer you have to write. So in that question paper, they have asked 2 complications of tracheostomy, but I have given almost all complications of tracheostomy. Whichever you are remembering, you can write it. So immediate, that is after doing within first few hours, loss of airway, bleeding, pneumothorax, pneumomediastinum, surgical emphysema, esophageal injury, recurrent laryngeal nerve damage, intermediate, that is within first 10 days, tube dislodgement, tube obstruction with secretions, bleeding, infection. Long term, granuloma, that is stoma or tube tip from suctioning, vascular erosion, suprastomal collapse, swallowing problems, issues with neck skin integrity, tracheal stenosis, tracheoesophageal fistula, which is very rare complication. So whichever is coming to your mind, suppose in this question paper they have asked only 2, in some question paper they will ask all, or in some question paper they will ask 4. According to the question you can answer it. So I am giving somewhat answers extra itself. Next question, list the clinical manifestations of pulmonary edema. So, symptoms are extreme shortness of breath, severe difficulty in breathing, feeling of air hunger or drowning, grunting sounds with breathing, inability to lie down, rales, that is abnormal rattling sound, restlessness, wheezing, anxiety, coughing, excessive sweating, pale skin, nasal flaring, hemoptysis, that is coughing up of blood, breathing will be absent temporarily. The signs are listening to the chest with a stethoscope during auscultation may show crackles and abnormal heart sounds. Chest x-ray may show fluid in the lung space. Echocardiogram may be performed in addition to chest x-ray. So next is classification of pneumothorax is your third question. So pneumothorax can be classified as spontaneous pneumothorax, traumatic pneumothorax. Spontaneous is again divided into primary spontaneous pneumothorax, secondary spontaneous pneumothorax. Traumatic is again divided into iatrogenic pneumothorax and non-iatrogenic pneumothorax. Iatrogenic is again divided into iatrogenic pneumothorax due to interventilational procedures or positive pressure ventilation. Non-iatrogenic is due to penetrating trauma or blunt trauma. In addition, pneumothorax can be classified as closed pneumothorax, open pneumothorax and tension pneumothorax. Next, fourth question is types of shock. So either you can write as cardiogenic shock, which can be intracardiac or extracardiac shock, hypovolemic shock, distributive shock. Under distributive shock, you have septic shock, neurogenic shock, which means spinal shock, or shock due to Addisonian crisis or adrenal insufficiency, anaphylactic shock. So, or simply you can write as hypovolemic shock, cardiogenic shock, neurogenic shock, septic shock, anaphylactic shock. Fifth question is types of hernia. Hernia is classified as inguinal hernia. Under inguinal hernia, you have indirect inguinal hernia, direct inguinal hernia, hiatus hernia or diaphragmatic hernia, femoral hernia, umbilical hernia or congenital hernia, which can be either congenital or acquired, insertional hernia or ventral hernia. Etiology of gastritis: bacterial infection, mainly Helicobacter pylori infection, non-steroidal anti-inflammatory drugs like aspirin, autoimmune disorders, bile reflux disease, stress, alcohol addiction, cocaine, radiotherapy and chemotherapy, or you can tell some other things like Crohn's disease, sarcoidosis, isolated granulomatous gastritis. Remaining under we have seen in the previous slide itself. Crohn's disease, sarcoidosis, isolated granulomatous gastritis are extra things which we have not seen in the previous slide. And the H. pylori infection, that is Helicobacter pylori bacterial infection. Seventh question, what are all the common drugs used in ICU? So they have asked 2 common drugs used in ICU, but I have given many drugs. Okay, so anything you can write. Under OPIs, morphine, fentanyl, pethidine, okay, naloxone. Then benzodiazepines, diazepam, midazolam, lorazepam, flumazenil. Sedatives, propofol. And the main groups of drugs in CCU are as follows: lignocaine, propranolol, amiodarone, digoxin, adrenaline, verapamil, adenosine, aspirin, atorvastatin, GTN, streptokinase, isosorbate dinitrate, soda bicarbonate, sodium bicarbonate. Next question is stages of illness. So first is experiencing symptoms, first stage. Second stage, assumption of sick role. Third stage, medical care contact. Fourth stage, assuming a dependent role. Fifth stage, achieving recovery and rehabilitation. Next, ninth question is fumigation. Fumigation is a process of gaseous sterilization which is used for killing of microorganisms and preservation of microbial growth in air, surface of wall or floor. It is generally used in pharmaceuticals, operation theatres, hospitals, hotels and offices and wherever required. Methods of fumigation: completely fills an area with gaseous fumigants to suffocate or poison like the microbes and pests within. Requirements for fumigation: only they have asked definition, but for your knowledge I am telling. Personal protective equipment like face protection, goggles, mask or face shield, gloves, gown or or head cover, okay. Then rubber boots, formalin or saturated formaldehyde solution. This is very very important. With formalin or formaldehyde only you are going to fumigate. Distilled water, electric boiler, potassium permanganate, ammonia, with all these things you can do fumigation. So you should not forget formalin, main important thing which is used in fumigation. Next is any 2 investigations used in vascular disease. Here they have asked only 2, but I have given almost all investigations. Vascular ultrasound, catheter angiography, CT angiography, MRI angiography, or blood picture, biochemical investigations, blood test, lipid profile, ECG, echocardiography, chest x-ray, abdominal x-ray, CT scan, MRI or magnetic resonance angiography, Doppler studies to detect, that is Doppler ultrasound blood flow detection, colored Doppler duplex scan, plethysmography, angiography or arteriography. So these are all the various investigations. Out of this they have asked only two. So why I am giving everything means if you are remembering everything, at least two you will be able to write confidently. So thanks for watching this video. Hope this video is clear for you all. So why I am concentrating on 2 marks means because if you are going to answer 2 marks, pakkali you will be getting a 20 out of 20 also if you have written everything correctly. So that will be going to boost up your marks. If you like my video, please give a thumbs up, share and subscribe to Science Easy Tech channel. My previous videos link I have given in description box, suggested end card and iCard, or you can watch our channel playlist for more nursing related videos. Thank you friends. Keep supporting to Science Easy Tech channel.